So week 4. So that means we're doing another 4 remedies, and we'll be up to 16 remedies. So rocketing through. So this week we're doing Allium, Cepa, Sulph, Ipecac, and Nat-mer. We're going to be looking at the repetition of a remedy, which you know how and when to do that. Repetition of a dose, how and when to do that. What's happening when things are going on, just to make sure you know, give you some ideas of how to handle it. How do you know if it's the right remedy or not? And also these 4 remedies, Allium, Cepa, Nat-mer, Sulph, Ipecac. And we're going to do our practice cases again. Are you happy to do the practice cases, or do you want to take them home and do them? You happy to do them together?
I'm okay with doing them together, or you know, it doesn't really worry me. It's probably helpful if we're sharing it, but if people are more comfortable doing it at home and having a think about it, that's okay.
Yeah, I'm happy to do it.
Yeah, I like to do it
together.
Yeah.
But it's input.
Yeah. Pick each other's brains.
Yeah. All right, that sounds good. I wasn't sure. I suddenly thought, well, sometimes, you know, it can be nice to go home and have some practice with, but anyway. But it is nice to do it together and just get a feel when it's fresh. So general guidelines of repeating or repetition of a remedy. So we usually say up to 3 times every 2 to 4 hours, depending on the potency. We'll go over that in a minute, until you observe an effect. When the symptoms return after initial improvement, even if the improvement has been brief. So, for example, if they've been vomiting and you give them a remedy and it stops, and they might be all right for half an hour, and then it starts to come back again, then you give another dose. And again, it'll stop. This time it might stop for 45 minutes, an hour, and then it'll come back. So that one, you can do it that way, just match what's happening. The other one is where you can give it every 15 minutes for a few doses, try and really knock it out. And then it depends really on how patient you are and how you want to sit back and see if you want to sit back and just observe the symptoms. And it also depends on how intense the symptoms are. So the more intense, the quicker we dose. The less intense, the slower we dose. So, and obviously, whenever the original symptom picture returns, and also if the medicine has been antidoted. Now that has been antidoted, sometimes if you use essential oils or if you've had some tea or coffee, it can sometimes antidote it, meaning it just shortens the action. So you want to take another dose just to get it going again. That can be very hard to see. You just sort of realise suddenly it comes back again, so you give another dose. So they're very similar. So this has been taken from Ullman. He's a famous homeopath in America, actually. So sometimes it's difficult to tell at first whether the medicine has acted or exactly how long to wait. So generally we say that it only needs to be repeated when the effect's worn off. So you can give it only once, which is what we were saying before. You can see if the person's improving, and then repeat it only if they get worse again. So with diarrhea or nausea, or if they've got a cold, you know, they're sneezing and they're irritable, and you notice when you give them a remedy, everything calms down. It might not disappear, but just things just start to calm down. And also the other option, though, is to give it on a schedule. So because we're doing it in acute, again, depending on the intensity. So if it's just a slow with the cold, you can give it every 2 hours, every few hours, to see if it starts to shift it. But if it's, you know, like a fever or a vomiting or a, you know, something more intense, diarrhea, stomach pains, all of that sort of stuff, then you can give it every 15 minutes because you're matching the intensity of it. And you give it up to 3 doses. And we always say 3 or 4 doses before you switch, before you decide whether it's working or not, just to see if you can get some improvement from it. So if the illness is severe, what's happening and what to do. So if it's severe, rapid onset, dose needs to be given frequently. So that's the whole intensity equals frequency. Again, yeah, every 15 to 30 minutes, and you can seek medical care. We've spoken about this before, where if you're not happy or you're not comfortable or you're not confident, just give the remedies and keep giving it to them in the car on the way to hospital, or, you know, to the way to doctor, and see if that helps. You don't have to wait until you're really frazzled and you're not sure. But generally, you know, you give a couple of doses. If nothing's happening, then you would, you know, if you want to go, then you could give another dose and keep going, or you could change to a different remedy. Obviously, if the symptoms develop slowly and aren't very severe, then you just give it. So with hay fever or with things that are just come on gradually, you could do it every hour. We spoke, I think, last week about aggravations and worsening of symptoms. It can be hard to tell in an acute, but you can see it, like the nausea can get worse. Like, okay, is that possible? But it actually can. And or then stomach cramps actually get worse. So
Adam, client
it doesn't have to be. I meant to ask you, I'll get you to mute if that's all right, just for a second, then we'll ask questions. I forgot about that, just because I'm recording. So yeah, if you see an aggravation, it's usually just, really, it's just more of the same. So if you see that the condition is getting worse, then really the remedy's not working, so you would change remedy. Sometimes it will be a good remedy for a certain part of the symptom picture or the illness. So maybe the first half, you know, needs a remedy, and then the second half, to get it to completion, to clear it up, needs a second remedy. So sometimes if improvement has slowed or stopped, then you can, and you know, giving the remedy isn't helping shift to the next level, then you can definitely change remedies then, and that could be halfway through. And sometimes you fix the nausea, but you haven't fixed anything else. So they feel better there, but nothing else is shifting. And that's okay. It just means the body took what it could, did what it could with that remedy, but it wasn't going to take it the whole way. That's okay. Yes, so if you've given 3 doses of the remedy without any difference, if you notice no change, then you obviously give the next best remedy. Antidoting the action of the first remedy. Look, it doesn't matter if you antidote the next remedy, you'll be okay. That's more in chronic. So the proof that you've given the correct medicine is improvement in your patient's condition, obviously. So you don't need to repeat it if they're going well more than 3 times if you haven't noticed any change. But if there's been change for the better, stay with it. Does that make sense? Were there any questions here? Sorry. I'm sort of repeating myself over and over, but it's just different ways of saying the same thing.
Well, I'd just like to ask, you may have covered this before and I've missed it, but with this antidoting, when you give people homeopathics, do you need to tell them not to drink tea or coffee and to keep not to
No.
put essential oils on them? You don't?
Yes, with the essential oils you do. The tea and
Oh, you
coffee
do?
is not so strong. So,
Okay.
so what you do need to do is when you take them, you need to take them 10 minutes away from food. So it needs to be on a clean palate, or food or coffee or tea.
Right. Yeah.
So water only.
Yeah.
And with the oils, what I usually say is give a remedy first, 10 minutes. Give it enough time to have gone in the system, and then do your oils. Because what happens is when you've got the oil bottle open and the remedy bottle open, the oil bottle can antidote the remedy bottle.
Right.
So they can't really be open together. So best to do the remedy first and then do your oils. So they can be combined like that. And the same with toothpaste, like the you know, it used to be, you know, you can't have mints or anything, but that's a very old way of treating. You know, if the remedy is going to work, it's going to work. But it's okay. It's not going to antidote at 10 minutes after taking it if it's the right remedy. If it's the wrong remedy, then it's the wrong remedy. It's just not going to work. So whether you brushed your teeth or had some coffee, it's not really antidoting. It's just not working. So yes. So best rule of thumb is to repeat the medicine only after the first dose has shown a good effect, or when the symptoms begin to reappear after being relieved. So even if the improvement is brief, you'll still need to repeat it. Because sometimes you'll keep these medicines going for a couple of days, a few days. Like if you've had a cough, cold, fever, you know, they may need to take them for 3 or 4 days. Well, you're not going to do them every 15 minutes or every 2 hours that long. You know, as things start to improve, you reduce the dosage and you can come down to 3 times a day until it clears, even twice a day until you feel like it's all gone. Yeah, and if the improvement lasts for a long time, hours or days, yeah, that's more again in chronic. These days, though, you know, people's symptoms are pretty strong and they seem to happen every day. So we tend to repeat it daily for a bit until you get on top of things. However, if you aren't sure what to do, sometimes before you give a remedy, before you even decide, we have to sometimes let the symptoms present themselves a bit more. So someone might just say they feel a bit off or they've got a bit of a sore throat. And sometimes, apart from doing your normal, you know, vitamin C's and zincs or whatever, you have to wait until you get more symptoms because you've only got one sometimes. It's really not helping you. Sometimes you have to observe them. Sometimes, obviously, too, the person will get over it without needing a remedy. So they might just be something that lasts for, you know, 12 hours. And it doesn't get any worse. It just sits there and then it disappears. Sometimes we don't need to come in with help. And that's where, particularly if the body is used to doing and healing itself, you will find that you don't always have to interfere with it. But yeah, when it comes to things, generally we like to try and do something. So summary, repeat up to 3 times, either every 2 to 4 hours until you observe an effect. Now the potencies in the first aid kit are 30C. They're a middle of the range. Bottom is 6C, then it goes 30C, then it goes 200C, and then it goes 1M, which is the 1000. And that sort of gives you a little bit of a picture for the intensity, because the higher the potency, the more intense the symptoms usually. So in fevers and things, I will often go up to a 200 or an M, especially in earaches, kids, you know, where they're really, really painful when they need relief. But a 30C will do just as much good. You can do a lot. Do fevers, you can do earaches, you can do all of that with a 30C. So don't feel like you need to have higher ones. 30C covers it also covers different intensities. So it just means you have to give it a bit more often. And the symptoms return after initial improvement, obviously. That's when you've repeated. And whenever the original symptom picture returns, so if it all comes back, then you'd also repeat it again. If the medicine has been antidoted, if you have done essential oils or anything strong that will antidote it, generally it is strong stuff. You will need to take the medicine again. I'm just going to come and get myself a drink of water. Just give me 2 seconds. Just going to pause this. And I just need a glass of water and I forgot to bring one in. Chat amongst yourselves. Actually, I don't know. Sorry about that. Sorry, I'm not sure what happened there. Let me just check. Oh, I thought I'd pause the recording, but I mustn't have. Okay. Manage my version share. Yeah. Okay. Okay. Sorry about that. All right. So first sign of improvement might be that the person feels better in themselves. And this can come on with any changes, before any changes. So sometimes, you know, if you're feeling grumpy and irritable and just feeling off as well with the symptoms, you just start to feel calmer and just not as agitated. And you notice sometimes too with children or with young adults, when you give a remedy that's the right remedy for them, they go and put themselves to bed or they go to sleep. And same with yourself. If you've taken something and you suddenly get this overwhelming urge to just sleep and rest, that's a good sign. It means you have the right remedy. So you just start to feel improvement. Even if the illness isn't gone, you just know you're on the right track. Obviously, if things are deteriorating and you really, things just aren't working, then obviously seek help. Don't persist. Alrighty. Any questions before we go on to the remedies? Repetition of dose. When to, how long for?
Tanya, I want to ask a question. Probably it's a little bit outside what you just said, but I'm curious because you know muscle testing, yeah?
Yeah. Yeah.
And you just mentioned if one symptom, only one.
Anyone? What happened?
You've cut out. You've cut out.
And choose 3 symptoms. In this case, would you?
Esther, you're cutting out.
I'm waiting. I thought she might come back. Sometimes it catches up, but it hasn't.
No, she looks frozen.
Yeah, I think you're frozen. Esther, I don't know if it's possible to type it in the chat. Would that be quicker?
I think she's got problems with her connection.
Yeah.
Yep.
Okay, she'll come back. Has anybody else got any questions about repeating and symptoms returning and when to change and all fairly clear?
No. Yep.
Okay. Cool. All right. So when Esther comes back, we'll answer her question. Oh, the thing is, I'll probably have to let her in. What? How it works. Oh, yep, that's what it's telling me. So, Allium Cepa, good old onion remedy. Yep, she's trying to. So we'll just give her a chance to. Are you back, Esther? Oh, just go continue the button. All right, good old onion remedy. Allium Cepa stands for, for the Allium family, which is garlic as well. We tend to use these for allergies, hay fever, colds, watery eyes, dullness. These are some of the symptoms you'll see: sleepiness, headache, itchy throat, and burning pain. Okay, Allium Cepa. It's made from red onion, actually. Hay fever, colds, congestive headaches, irritated eyes, frequent sneezing, allergies, coughs, and it's often caused by getting feet wet. So it's made from red onion, and we all know that French onion soup or onion soup is very good for colds. Even sipping raw onion juice, they used to do that, was also a cold cure many moons ago. So, so we know that Allium Cepa, onions is a good old remedy. So it's often for allergic coryza, which is catarrh or dripping nose, basically, mucous membranes. Person may be sleepy, find it difficult to concentrate. Their brain's a bit foggy. They're often worse in the evening and in warm rooms, and they're better for open air, even though their hay fever might be aggravated. They just want fresh air. They often have a desire for onion, though not always, because sometimes they don't want onions, so it can vary. But if there is anything to do with onions in their symptom picture, obviously you would look at Allium Cepa. So general coryza with frequent sneezing and profuse acrid discharge, so it does burn again. The lips and the nose. We had the similar thing with Arsenicum album, you may remember. Also, the lacrimation means watering of the eyes, which can also be burning as well, but only the eyes are burning, not the discharge. So that's a little bit confusing, actually. So the eyes feel like they're burning, but when they drip down, it doesn't burn, on the cheeks or anything. It's just, it just makes the eyes just feel like they're burning, even though the discharge doesn't burn, whereas for some reason out of the nose it does. So that can go down to the chest with mucus, cough, and rattling as well. But usually it's easy to cough out and stuff. There's a lot of mucus everywhere, just like the liquid. So yeah, lots of coryza, basically thin runny snot, and clear, usually clear. It's not usually coloured. And it can go down to the bronchial tubes. Often worse at night, warm room, again, they want. The throat can be scratchy and itchy, and the headache can also come on because they're full of liquid again. And getting feet wet can cause colds, basically, or be the reason why they come down for a cold. So, yeah, common cold, so different complaints again, common cold, just said before, acrid nasal discharge, it's always profuse, runny and clear, dripping basically. Throats, viral infections that can still be having drippy nose and itchy eyes and a scratchy throat. Hay fever again, and the odour of flowers can trigger it off. And for this one, the eyes do water but don't burn. So, and the headaches are worse when the eyes are closed, which is sometimes different with migraines, that people want their eyes closed. Sensitive to light, but they want to keep their eyes open. Aches and throbs. Again, the eyes, the nose, and the head are basically the main areas of Allium Cepa. As you can imagine, cut an onion. It all seems to happen up this top area. Again, eyes feel red, irritated, burning, itch in the eyes. So this can just be like allergies, very simple allergies, watering eyes. You just note that they've reacted to something. They're the main ones. It's a fairly simple remedy, but it's really good for colds and hay fevers. Really, that's its main repertoire. I've used it numerous times for different colds and different hay fevers. Family, myself, kids. You know, it gets used relatively frequently, and you do tend to find that some people will respond to some remedies better than others. So once you've got a few either hay fever remedies or a few cold remedies or a few throat remedies, you just sort of tend to, you notice you use them on repeat. All right. Any questions with Allium Cepa? It's fairly simple.
Mm-hmm.
In your book, if you've got the rainbow book, where I can't see myself, so I'm assuming you can see that. It's in the back. It has what we call a materia medica, and it will go through the actual. Outline of pretty much what's in here, a little bit less, but whereas the front of the book tells you, you know, all the conditions. So if you want to look up and just check the symptoms, looking in the materia medica is a good one. The other materia medica, obviously, that I use, and you can get copies of as well. There's a couple of places and I can share those with you. This is pretty old, as you can see, it's very old. It's been prepared a few times. And you can buy them from shops here in Australia, but they're made in India. So they're like a very fine papered, they're almost like a Bible. But it has lots and lots of symptoms in it. It has all the, you know, the head, the mind, the face, the throat, the nose, and it describes each thing, which is why they're just a lot more detail if you want more detail, if you're a detail. Oh, it's just having trouble. Hey, you getting there?
Did you ask me?
Yep.
Yeah, I'm getting there. I use my phone. Just the internet's so bad, so I just use 4G at home with my phone. So, oh, good. Sorry, I'll keep
No, don't be
dropping
sorry.
and interrupt you.
You just.
Oh, good
I
now.
just- Yep. Did you want to ask your question, or where are you at? Are you the boat?
Oh, yes, but I don't know whether. Yes, so my question is actually is you mentioned normally when the first symptom coming up, you will wait until, the other more symptoms coming up help you to define what remedy is most suitable.
Yeah.
And, but because like Tanya, muscle testing.
Yeah.
So is that possible using your body, like even when your first symptom come up, but you're doing muscle testing, your body naturally know what it is without waiting for the other two symptoms coming up?
You can, if you feel like you can narrow it down to a few remedies, absolutely. But I wouldn't give your body the whole list of remedies. Like, so what can happen? My son, he definitely has it down pat now. He will choose 2 or 3 remedies and he'll hold them and he'll let his body tell him which one, or sometimes he'll use a pendulum, but he'll let his body tell him which one it says yes or no to. And he's getting that down pretty quickly these days. So you can do it. Absolutely, you can do it. Hey, Lynn.
Yes.
But you'd still have to have a feel for the symptoms and what you're dealing with. But again, I think, we've over time, I've sort of taught him, or if he'll ring me and I'll say, have you looked at this or this? And he'll have a feel for it. So you can do that, yes, if you feel confident with that. If not, we wait for some symptoms, just to be sure. But you don't have to do that. You can pick it pretty.
Yeah, thanks, Tanya. Yes.
Okay.
I did it and came unstuck this week.
What happened?
Well, I got a really scratchy throat and I thought, so I took aconite because it was coming on. And I tested yes for aconite, and then it went into a very dry cough and a watery runny nose. So I went to arsenicum, still didn't work. But I realised now that what I should have probably had is allium, the allium.
Yeah, maybe.
I think but it was this really dry hacking cough that really threw me.
That it almost could be bryonia.
Oh, okay. Now I knew you'd find another one.
But that's okay. Allium Cepa absolutely could, but it's not so much. It's more of a scratchy throat. It's not so much of a. There's a lot more runny. There's more runny nose with it too. I would have thought you'd have the dry throat with a runny nose. Did you have?
No, it was a really tickly throat, like really scratchy. And as I said, the dry cough, a coughing fit where you almost turn yourself inside out.
Did we
But
do
then
bryonia?
again, when was the other thing that'll set me off.
Say that again. The cold set.
Hot to cold. If I got out, like I got out of the car today, a warm car into the cold air, and I had such a bad dry coughing fit, somebody had to rush out of a cafe and give me some water. So I got confused. What I'm saying is, between them, all of those symptoms were across quite a few
remedies. Yeah.
Remedies.
Well, you do have to just pick one and take a few doses. If it doesn't work, then switch to the other remedy and take a dose. It's all we can really do. Or you test up if you can test up which one feels right. Sometimes,
but it didn't. It let me down because the aconite, it said no after I'd taken a couple of doses, and then it went on to when I tested it for the arsenicum, it said yes.
Yeah.
But it didn't get any better on the arsenicum.
No, which is almost it's teaching you or showing you that it's going through the process of, taking it for a couple of doses, seeing if it's helping. No, that's not the right remedy. Did you narrow it down to 3 or 4 remedies?
Well, I just narrowed it down to the ones we've done, really.
Yeah, yeah.
So- no, it's just that was interesting when you were saying how you went through the remedies. I thought I'd give what happened to me as an example.
Yeah, it's a good example. Bryonia, we have done Bryonia. I thought we did.
Yeah, we
I,
have.
Yeah, we
I would
have.
look at, I would
But
look at
it
Bryonia.
hadn't
Didn't read?
occurred to me on the list.
Yeah, no, that's okay. I have a read of that one and see, just because a very dry cough is often Bryonia. That's it. You just end up with little bits that you remember. You'll get there.
Yeah,
You
but
know.
with Baroni, it says dry cough that hurts. Well, it doesn't hurt until I cough so much that it, yeah.
Yeah. I see. Yes, you got the hurt bit.
It's just
It doesn't always.
finding, yeah, with these things, there are so many crossovers of symptoms.
Yes,
Kay,
it can
can
be.
I ask a question?
Yeah.
When Kay says, I don't know if she can hear me, I guess so. When she says, oh, you can. When you said it said yes, what were you muscle testing or using a pendulum or
No,
what
I
were
was
you
muscle
doing?
testing.
Okay, on yourself.
Yeah.
Yeah, okay.
And the only way I can muscle test is with a heavy kettle. Because I can alter all of the, pendulums, I can alter sway tests, the other tests I can alter. So I have to have a heavy kettle.
Oh, I'm pretty interested to see how you do that. I've never heard of that one.
This one I got, you should get a kettle that's reasonably heavy.
Yeah.
So my name is Kay and I can lift it up. But if I say my name is Lynn, there is no way.
Oh, I see. I get what you mean. It's got that resistance built into it, so that you can't override it. You can't override the muscle test. Okay. Okay. Interesting. Thank you, Kate.
That's okay.
Yeah. We're all learning something.
Yeah. Sorry, Tanya.
It's fascinating, isn't it?
To say that yeah.
So obviously it cleared. You're okay now.
No, I've still got the dry cough.
We'll try the Bryonia. Kettle test.
Oh, you're only around. Okay, yeah, well. Okay.
We'll
It's
keep
just giving me
going.
one I hadn't thought of.
Yeah. We'll keep going. There might be
thanks.
one here tonight, but I don't think so. All right. So NATMER. NATMER is often one for grief, sadness, deep wounds, meaning emotional wounds, not physical wounds. Vulnerable, introverted, easily offended, dwelling on past disappointments, often used with the common cold as well. That's why we've done a few of these, because I know they look similar, but we're just trying to differentiate. Hay fever again, same as Allium and Cepa. They're actually worse from the seaside or from being at the sea, and headaches as well. And as you can see from the picture, it's made from salt, which is interesting that they have seaside aggravation. Again, sadness, grief, disappointment, headaches, worse from the sun. They've also a herpes remedy for either the herpes on the lips or the anus. Hay fever, colds, eczema can be an eczema remedy, cracked lips, and it has anemia in it, which is low iron. So NATMER is made from common table salt, sodium chloride. Treats a large range of acute and chronic problems. Often follows grief, heartache, disappointment. And so NATMER can appear hard or closed. They don't want to chat and they prefer to be alone. They're sensitive and easily hurt, but avoid talking about their problems and don't want to be comforted or consoled. I remember when my son was young, he hated it when I brought attention to him if he wasn't feeling well or whatever. He just wanted to be left alone. So, or if he'd fallen over and hurt himself, I wasn't allowed to console him. So that's this whole, they just don't want to be comforted. So it has a lot of dryness and cracking skin, so eczema, psoriasis, and as you can imagine, salt dries everything out. So that would make sense as well, except that, they do have cold symptoms. So herpetic eruptions, they're often used for cold sores on the lips, and obviously on the anus as well. but constipation, they'll often have dry, hard, difficult, crumbling stool. And again, that's a similar picture if you think about salt drives everything out. But that does cause constipation, which is often from dehydration. Headaches beginning with blindness or zigzagging and from eye strain. And they can have emaciation, which means losing weight or not putting, not staying well, even though they're eating well. Weeping, sadness, aversion to company, difficulty urinating in public restrooms, which is another interesting one. Nux bomb, did we go through that? That one actually has, they can't go for a poo in a public, like they'll hold on while they're away at camp or away on holidays till they feel comfortable. And this one's having a wee. So there's a couple of different nuances to the remedies. They have cravings for salt, understandably, as well. They can be very thirsty, and they're worse at the seashore or the air. And their time can be 10 to 11 a.m. and they're better in cold bathing or going without regular meals. They do have colds and respiratory, but it's usually starting with sneezing, and they have more of a watery or an egg white discharge with a salty taste. Interesting. Blocked nose, alternating with a watery post-nasal drip, so they can alternate. Hay fever again, diffuse nasal discharge, sneezing, and they will have watery eyes. But again, it's usually this egg white discharge. Even though it's clear, even though it's watery, it still has a funny colour. Worst 10 till 3. This one's saying 10 till 3, 10 till 11. For some reason, the headaches seem to be within that range. They're often caused by sun or by excess light, following grief, and can feel like a hammer beating in the head. So, yeah, children can get these, with school, if they can get them with work, either before or while they're at school. They can develop headaches, and that's usually if they're not happy with whatever's happening at school. Skin problems, dryness of skin, but you can have oiliness of the face and the hair, like it comes out, there's an excess somewhere else, cause, the dryness, and so the body's trying to make up for it. Dry, chapped lips can be a problem, and the lower lip can be cracked. Again, cold sores after these being sun exposure, which can happen, but also cold sores after being sick with a cold can also happen. Following grief as well. After stress, which will often bring on cold sores too. Insomnia and sleep problems, again from grief, sadness, difficulty going to sleep, or unable to get to sleep again after waking in the night, and they can have vivid dreams. Again, this grief and disappointment, it's got a big picture, it's a big part of that nerve, and they have an inability to cry often, or they will cry alone. They don't like to talk about it, a bit like, not wanting consolation. They will keep it to themselves. So menstrual and PMS symptoms can irritability prior to or depression, and sometimes they'll get migraines or headaches with their menstruation as well. And their menstruation can be irregular meaning, not on time, all over the place, or it can be profuse, or it can be suppressed, not coming properly. And a dry vagina, which is again in keeping with the dryness of the remedy. Are there any questions with that one?
Can I ask a question?
Yeah.
Tanya? I think it was the slide before. It said good for eczema.
Yes.
Eczema can often be more chronic.
Yes.
So even if it was a chronic thing, you would use Natmer?
You could try it. Maybe probably for acute, you might look at dermatitis, because dermatitis is more of a contact eczema.
Yeah, it's just interesting because I get eczema on my feet,
Yeah.
and it comes up in little like blisters,
Yeah.
and my feet are, then become really, really dry.
Yeah.
But it was interesting that you said on the face, oily skin.
Yes.
And
yes.
that's when I have eczema on my feet, I have really oily facial skin, oily face.
Yep.
So I'm just wondering if that would be useful to try Netmer.
Absolutely. Yeah, absolutely. You could give that.
Because
a
I
go.
would never have put the two together.
Right.
Opposite ends of my body, I would not have even thought about that.
No, when we don't, because this is looking at the whole picture.
Absolutely.
This is why we call it the whole picture.
Yeah. So that was really, like, I was fascinated as you were saying that when you said eczema, and then like I think it was on your next slide, you've got the oily skin.
Yeah, the face.
Yeah. Dry. My skin is dry, like my cheeks, but my nose and my chin and my hair all oily.
Yeah.
So that was interesting. And my lips get dry and cracked. So okay, there's only really 2 symptoms, but
well, sort of 3.
Sort of.
Because you've got your lips, your hair, and your feet. But it would be worth a try, absolutely.
Yeah, that's really interesting because when I'm thinking of like a cold symptoms, I would be thinking of 3 things relating to a cold that you wouldn't normally have. So that's fascinating that, because I would never have put them together.
No, no, and you are talking chronic there because they're things you tend to have all the time.
Yeah. Okay, great. Thank you.
Okay. With Hepar Sulph. Is Esther in? Sorry.
And just before you go on to that one, can I ask you a question? So with the Allium Cepa, you said mainly used, like it's the one for colds and hay fever. Is there a sort of blanket heading for the Netmer that you mainly use it for?
Well, it is often used for colds.
Okay then.
Yeah,
I got it. But with those different sort of symptoms, that's okay. Got it. That's okay. Colds.
Yeah, but there are that you can see the differences.
Definitely quite different, aren't they?
Yeah.
Yeah.
Because you can get different colds, obviously. And the other head thing is the cold sores.
And cold sores, right? Yeah. Yeah.
Yeah. That's
okay. Thank you, Tab.
Yeah,
that was it.
That's all good. Okay. So Hepar Sulph. Hepar Sulph is they don't like cold wind, and this is similar again to aconite, but anyway, the cold wind aggravates them. They can be sour. They can have a sour smell about them. They could have sour taste, but they're often chilly, and they're very hypersensitive actually. So Hepar Sulph often have abscesses, and this can also be used in a common cold, but this is a bit more of a ripe cold. When I say that, more of almost an infected cold would be. They can have a cough, can be in croups. These often have earache, and injuries, and sore throat. These are often got quite a bit of pussy or infection, which is why the abscess is quite strong in it. So whilst this can be a cold, it can usually be an infected cold, not just runny symptoms of it, but it's gone into, infection. So Hep Sulph calcareum is made from calcium sulfide prepared using oyster shells. So they crush down the oyster.
Wow.
Yeah. Which is why the picture of the oyster in the other slide. So it has some properties of calcium and some of sulfur in it. So Hepar actually means calcareum, sulfur. But as a medicine, it's different from sulfur by itself and calcium by itself in terms of what it fixes. So it's prepared by heating the finely powdered oyster shell with flowers of sulfur, which, did I have a picture of that? I thought I did. Yeah, this is the flowers of sulfur down here, sulfur crystals. And then they grind it all together, and then they dissolve it in hydrochloric acid. and create the remedy from it. So these are complaints from cold wind or cold air or just anything cold. Sour sweat, so they might like sour food, or they've got a sour smell to them. Just so I know they've got that thick smell. I think I may have mentioned in a couple of things ago that Tamara used to always complain. She always knew when Adam was getting sick or getting sick. She always said he had a funny smell. And often Hepar Sulph was a remedy that we used for him. So, but not always, you know, depends on. So, worse getting cold, dry weather, fresh air, or any pressure. They don't like pressure on them, and being uncovered. I know my mother will, when she's getting sick, I notice she's always wanting to wear a scarf. You know, she wants to keep herself warm. It's like she wants to be covered up. So, so chilly. They do get very chilly. It's one of the chilliest medicines. They like to be wrapped up and warm. They want everything to be cozy and hot. But they also can get really angry and irritable and difficult. They're just hypersensitive. It's quite acute in terms of that sensitivity. They get a little bit crotchety. So they hate the cold. There's a vital lack of heat, which means they're also more prone to colds. So they're sensitive when they're sick. So they can't stand any part of their body being out of the covers at night. And actually that can worsen the symptoms. So if kids get cold overnight, they can get worse. Oversensitivity is a keynote, mentally, physically, pain, touch, pressure. So with their sore throats, you know, and swallowing can be painful as well. Even though they might like to be rugged up, it can't be pressing necessarily hard on anything. They're difficult, irritable, prone to anger, and at least provocation. And they can also be impulsive. So abscesses, we've used it, yeah, glands, roots of the teeth, definitely used it for teeth abscesses, and particularly if they're starting to discharge. It has got pus in it, and one of the rubrics or symptoms is splinter-like pain. So you'll get the splinter-like pains will come out throughout, whether it be in the throat, whether it be in the mouth, wherever it is. There is this splinter sensation like pains, and it can be sensitive to that. Again, the common cold, the catarrh or the nasal discharge drips down the back of the throat, and it can be smelly and yellow, which is what this whole funny smell can be. Sneezing as well on uncovering again, which is that whole getting cold. It is a big croup remedy, barking cough. Even though it's dry and croupy, it still has this mucus. It sounds dry, but yet they've got mucus. So it's a bit of a funny one. Again, getting a cough or coughing when they get cold, or if a cold, dry wind has struck them, and then cough comes on. Again, same with the croup, slightest breath of cold air, worse in the morning and for uncovering, choking, wheezing, rattling. And the mucus can be hard to bring up. Yes, that's that can be, there's a few with those, but it can sometimes be hard to get out. And sometimes, again, they get that splinter-like pain. Earache again, with smelly discharge and injuries as well, which are slow to heal. It can be good for clearing out pus and infection. It is one of our remedies that we use for it is one of our remedies we use almost like an antibiotic. You know, if there is infection and pus, we will use it for ears and for coughs and for sore throat. I had a client who had and must have had a chronic ear infection, and well, the teacher was saying that, you know, they weren't listening very well anyway. Went and had the ears checked, and it turned out there was a lot of stuff in there, and they wanted him to have surgery, you know, for grommets and all of that. So she came to me and said, you know, is there anything we could do? And so I put him on Hepar Sulph. I put him on that daily for probably, it was quite a while, a couple of months. And she told the audiologist that that's what she was going to do or whatever. And they said, oh, you can try, but nothing natural. They've never seen it work. She said, that's okay. Anyway, he came back a couple of months later. It was completely gone and all clear. So she was wrapped, and they were very surprised.
No, what? Sacrificed a chicken at midnight and cured him. Amazing.
I don't think they knew what to think, but so, you know, and that's because it was just chronic catarrh, I think, over time that it got infected and it's never really cleared properly, and his body needed help with clearing it. So so yeah, so that is Sulph. We've lost Annie. She's got a child that needs putting to bed or something, so she may join us again when she can. All right. So Ipecac. Ipecac's main thing is nausea and vomiting. It's basically known for that. It, you know, it affects the vagus nerve. If the vagus nerve has been affected, you know, you tend to get nausea and dizziness and vomiting and that sort of queasiness. It can also have hemorrhage in it, and it's either blood noses. It can also have bowel hemorrhaging. Got to be, obviously, you would maybe give remedy and go straight to have that looked at. And it also can have abdominal pains with the nausea. Nausea, vomiting, travel sickness, we use it a lot in. It can be for mucus cough as well, bronchitis, asthma, cold, but these are mucousy versions. Hemorrhage again, blood noses. So it's derived from a plant, and it was used to induce vomiting. If you notice, and yeah, it's used in case of accidental poisoning. It is basically known, if you have a look in any of the old apothecary or the old doctor's surgery, there was always a bottle of Ipecac on the shelf. So it's a very old remedy, very well-known remedy. I don't know if it's used in any of the medicines today, possible. So yeah. So they often are, they don't have any thirst, but they have a lot of saliva. So, you know, it's that nausea with saliva in it.
Oh, yeah.
Very nice one. And they seem to have a clean tongue, which is interesting with nausea too. And the vomiting, it doesn't matter how much they vomit, it doesn't relieve the nausea. And sometimes they actually feel worse for vomiting. So they can have these cutting pains or clutching pains around the navel and the tummy, and they can have diarrhea or a green, which can be green or even a molassesy, dark coloured bile, which is not very pleasant. Lack of thirst, but they have lots of saliva. Ipecac is good for respiratory complaints such as croup, bronchitis, asthma again, but it has this gagging, retchiness because of the mucus, because they can't get it out, and it causes them to have a coughing fit, but it also makes them feel sick. They can be irritable, they can be scornful, they can be hard to please. So tendency to bleeding. This, you don't have to have all of this in there, but you know, if you do have this as well as nausea, blood nose with nausea or bowels with nausea, it can be one to look at, or any bleeding. It's one to look at. So it can be caused by being moist, often humidity or anything like that. warm wind, overeating, or rich foods of veal and pork. Worse when they're lying down, and they're worse for the heat and the warmth. They're better in open air and for pressure and for rest. Now, Ipecac morning sickness, it's very good for too. Morning sickness remedy, and also with travel sickness, it can be a good one as well. The digestive issues, I don't know whether I've the story about the horse when we had Loretta, my daughter's white unicorn, we call her. She, I think we'd only had her a couple of years, not very long. We're still getting used to horses, and it was Christmas, and we were due to go to family for Christmas, and we're just getting ready to leave, and my daughter came, running out saying, "Mum, I need your help. The horse is sick." So, I went down to have a look and see what was wrong, and she said, "She looks like she's trying to vomit. She looks like she's sick, but horses can't vomit. They're not. She looked like she was sort of dry reaching or just not feeling very well." And so I thought, all right, well, I'll come back to the clinic and I'll just see what remedy I felt like. And as I'm running up the stairs, I just got this big sort of word in my head, Ipecac. Oh, okay, I can do Ipecac. That's it. That's nausea. And so I made up some Ipecac and I came back down, and we gave her one dose. And we sort of waited, and she looked at me and she shook her head and she went and ate some hay. We were like, oh, but she wasn't eating anything. So we were a bit like, okay, that's a really good sign. And then probably half an hour later, I gave her another dose just to be sure. And we didn't leave then for about an hour or so, and she was fine. Didn't want to. So yeah, so it fixed her in a couple of doses. I gave her another dose before we left just to make sure. But that was just going on the nausea, yeah. But it could have been colic, it could have been anything which is deadly for horses, or can be, not necessarily. But so yeah, I was wrapped. It was worth its weight in gold. So that nausea is obviously a strong part of it. Okay, and the bronchitis as well, chest rattling, mucus, gagging again, vomiting. All of that has to have those symptoms in it, but it's a really good remedy to keep in mind. All right. Oh, that was it with the remedies. We did it.
Hey.
All right. Any questions on Ipecac at all? It's all pretty simple. It's a fairly simple remedy, that one. Same with Allium, Cepa. There's two sort of nice simple ones. Fairly easy and specific. So, can you read these cases?
Yep.
I don't know how to make them bigger.
It's okay.
So number one, Eliza has a cold after emotional upset with her teacher, and now has a cold sore and is feeling depressed. She's wanting to stay home, but she's very thirsty.
That'd be Natmer.
Woohoo! Yep. What makes you say that?
That well,
three
because
symptoms, if you can.
Oh, the three symptoms were cold
Yep.
sores.
Yep.
That wanting to be alone, or wanting to cry alone or be alone. I don't know about the. I obviously didn't take notes down about thirst. After an emotional upset, because it's their emotional wounds and so forth, isn't it? Yeah,
that's right. Everybody agree with that?
Yep.
So Alex has constant sneezing and runny nose. His eyes are red and irritated, but his tears are bland. He had been out mowing the grass, and when he came inside, he began sneezing, and his nose ran with a profuse, clear discharge.
Allium.
Allium.
Yeah, Allium.
Yep. As a Natmer, because
well, the clear mucus, isn't it? Is it the eyes? Hang on a second. The eyes are red and irritated, but his tears are bland.
Yeah.
There's where the tears don't burn, but you know, there's irritation in the eyes.
Yep.
Was that one? Yes, it was.
Yep. that
I've
was
written
that
down. I
one.
can't even read my own notes now.
And probably
that-
suffering from hay fever. 'cause of
Yeah,
the
exposure. Yeah, yeah.
And-
Allium.
Yeah. Yes, that's right. For mowing the grass.
Watery eyes. Yeah, yeah. Itchy throat. Hay fever.
All right.
Yeah.
And the frequent sneezing, was that in there? Oh no, he began sneezing. Yep. All right. So Joan has terrible travel sickness with constant nausea, not relieved by vomiting. She hates food and the smell of food. She's difficult to please and doesn't know what she wants. She has excessive saliva with nausea and is thirstless.
Ipecac.
Ipecac.
Yeah, Ipecac. Mm.
Yeah. So you can see that pretty clearly.
Mm.
So Paul has just found out that his girlfriend is leaving and he is sad, depressed, and has come down with a runny nose like a tap. Been sneezing and wants to be left alone. He just wants to eat salty chips.
That has to be the is that Nat Mur?
Mur.
Yeah, when he's
Yeah.
craved salt and yeah.
Yep. Yep.
What else was in there? What was the three things? Runny, did we say runny nose?
Yep.
Craved salt, very yeah.
Did you have a runny nose? I can't remember. Oh yeah, runny nose like a tap.
Sneeze,
Yep.
yeah, what's it? Yeah.
And grief or sadness.
And grief. Yeah,
Yes.
that's it, absolutely.
Yes.
Yeah, they're the three. Mm.
Okay.
How'd we do, teacher?
You did well. 4 out of 4. You ready for the
4 out
next
of 4.
Oh, she hasn't done.
But wait, there's more.
But wait, there's more.
I'll take my glasses off.
Oh, okay.
So Shelley has a violent toothache from a dental abscess. The pain is worse for coffee, warm drinks, and food. The toothache is relieved by cold drinks. That's not a differentiation I showed you, but there is tremendous hypersensitivity to the pain, and she is inconsolable with the pain. She's very quarrelsome and restless.
Sulph.
Yep.
Yeah.
Because
The main one is the fact that it's a violent toothache with the abscess. It's the pus, Sulph and pus, that
yep.
the
Yep.
main, and then the others back it up.
Yep. Yep. The hypersensitivity, they are very hypersensitive. Yep. And the quarrelsome and the restlessness, the irritability. All right, so Larry went swimming, and that night he began sneezing constantly. Then a runny nose started, and his eyes were irritated and burning. He came down with a head cold. He had a slight headache, but he didn't want the heater on.
But I haven't got. I have to keep flicking back, and I only took a few notes. So is that the one where they don't like salt brings it on, being exposure to something salty? No, hang on a second, I've lost myself. Nat Mur, is it? No, that's when they want. No, Nat Mur, worse from sea air.
Yeah.
He went for a swim, and yeah, colds. Has he got a cold? He's sneezing with a head cold. Yeah, is it Nat Mur?
No.
Allium.
Yeah.
Allium?
Why? Yep. Why is that, Chris?
The frequent sneezing.
Yep.
I haven't written that down.
Exposure to damp, wet conditions.
Yes.
So he's been
the
swimming,
wet.
so he's wet.
Yes.
What was the other one?
It's a bit of a tougher one, this one.
It is because it's not. His eyes are irritated and burning.
Yes. That's
Yeah,
right.
and made worse in the evening in warm rooms, so he didn't want the heater on. So I guess that's another one.
Yeah. Yep.
Yeah.
Yep.
Hmm.
So it was a bit tricky, but it
That's
can be
good.
how it works, as you know.
Makes you think.
It does.
Hmm.
It does. So David has cluster boils, the pain is burning and stinging, worse than extreme at once. Has a cluster of boils that are inflamed, very painful when the pain is burning and stinging, feels worse for extremes of temperature, and the boils rapidly form pus, which is foul smelling, and once open, The boil tends to become ulcerated and his sweat and breath are also offensive.
Sulph.
Yeah. Can you see that?
Yep.
Sulph.
Mhm.
All
Yeah.
right. And the last one. Vita has an extremely painful ear infection. She wakes at night screaming with pain, is oversensitive, annoyed, extremely restless. The GP says there's thick pus behind the eardrum. The discharge from the ear is smelly like old cheese. There may be perforation of the eardrum. She's worse from uncovering a draft, but better if kept warm and wrapped up. She craves vinegar and sour foods, so I don't know if we put any of that in. It is in your little booklet, but I haven't spoken about that.
Yeah, we did, but I don't know where it was, where I wrote it. I remember writing something like that down.
Yeah.
Yeah, that was Hepar Sulph.
This sounds
Yeah.
Desires vinegar,
Yeah.
pickles, condiments,
Yeah,
and
yeah.
alcohol.
Okay. Yeah.
Yep, it's
That's it.
Sulph again.
Yeah.
We've got